everybody high.
This article, published in the Journal of the American Heart Association, states that improved control of hypertension resulted in poor rather than better outcomes. The frequency of the crisis course of hypertension has doubled. Hospitalizations have become more frequent. Strokes, heart attacks, and other cardiovascular events dangerous to health have become more frequent. Scientists struck their hands how to understand what is the reason. I have seditious thought, and this thought is not to overdo it with the treatment of the patient. In my opinion, supported by the results of the article under discussion, my experience with my patients, and experience on myself, the reason is precisely in strict adherence to the requirements of existing recommendations for the control of arterial hypertension. In these recommendations, I think, in the first place, is not the idea of the best preservation of the health of the patient, but the interest of the pharmaceutical market, manufacturers and distributors of antihypertensive drugs. As a result, patients suffer because the disease is not a fool, and when you lower the pressure, the disease, raises it again with the inclusion of various kinds of additional mechanisms that are not at all useful but harmful to health. I, a hereditary hypertensive patient, regularly monitor my pressure, but I take medications when the pressure starts to act up, and as soon as it normalized, I don't use them for weeks. My observations of patients, some of whom strictly follow the recommendations of doctor, recommendation of guidelines, while others are like me, confirm the correctness of my approach to my own health, explain the inexplicable. Each symptom, high blood pressure is no exception, reflects the mechanisms of the development of the disease and compensatory and adaptive processes to them, because for some reason the body needs to increase pressure, and it will continue to do so despite our treatment. In other words, the essence of my seditious thought is that you need to think 7 times before deciding on tight control of blood pressure. Let us always be attentive to the nature of the human body, especially when it suffers from hypertension. The treatment of arterial hypertension should become exclusively individual, and all schemes should be cancelled. It's time for personalized medicine.
Thank you for watching.